The European Commission was formally notified of this cluster on May 2nd, and today, with no new case number, that date is the clearest fixed point on the timeline. This is Hantavirus Watch for Friday. No new cases today, which sounds like nothing, but in surveillance, a steady count is still a data point.
And we finally get a real number on the geography. 23 countries, 9 of them EU or EEA. That's the international scope I've been chasing all week.
Plus, a step back on what close contact actually means here, and a New York Times profile of the ship itself. Let's start with that May 2nd notification. Here's the precise sequence. May 2nd is the day the Commission was officially notified. WHO publication and passenger disembarkation are separate points on the timeline. This is the date that puts the outbreak on record at EU level.
Right, and the notice spells out why it went supranational at all. Andes is the one hantavirus that transmits person to person. So that answers what I kept asking. They're not just running protocol out of caution. The EC says it outright.
So the paperwork moved up a level. The risk profile didn't.
Which is exactly why the step back matters. CDC draws the line. Cabin sharing and caring for someone sick are the worry. Sitting near someone at dinner for 3 weeks? Different tier. That's the answer I've been demanding since Wednesday. There's the exposure ladder, close quarters and caregiving at the top, just being aboard down at the bottom.
And it's why a manifest trace is the right tool here, rather than scrubbing down the vessel. Spread tied to a sick person, not environmental exposure.
But here's my next gap. 9 EU and EEA health systems now have contacts flagged. What does a clinician in any one of those countries actually reach for when someone walks in? That's a 9-country problem with a number on it now.
Fair, the notification names the countries, but it doesn't line up the clinical guidance. That coordination piece is the live question.
And the Times piece, former passengers vouching that the crew took safety seriously. That's warm, but it's reassurance without specifics. Same as those operator statements I've been wary of.
Though it's worth one beat for a different reason. An expedition vessel skews older, international, 23 nationalities. That demographic is exactly what makes a 42-day monitoring window worth watching closely.
Fair enough. Passengers vouching for crew isn't the same as the company minimizing. I'll give the Times that distinction.
Here's European Commission.
The Commission was notified on 2 May 2026 of a cluster of severe respiratory illness on MV Hondius, a Dutch-flagged wildlife expedition ship with passengers and crew from 23 countries, including 9 EU-EEA countries. The virus has been identified as Andes Hantavirus, the only hantavirus that can be transmitted person to person, typically requiring close, prolonged contact. The risk to the EU-EEA general population is very low.
One date to pin down today, May 2nd. That's when the Commission was formally notified through the EU Early Warning and Response System. WHO publishing and the Hondius docking are different timestamps. This notification is the diplomatic clock start for the whole cluster.
And the notice finally puts a number on the geography. 23 countries, 9 of them EU or EEA. All week we've been gesturing at scattered contacts. That's the clearest statement of scope we've had.
Right, and no new case count today. The Commission restates where the cluster started without moving the number. And in surveillance terms, that steady count matters. The administrative layer is catching up, while the epidemiology holds steady.
And it says it flat out. Andes is the only hantavirus that can spread person to person. That answers the question I kept hammering. Were they running international tracing out of precaution, or because transmission on board was actually part of the concern? The Commission's notice points straight at that risk. Okay, so Andes virus can apparently spread person to person, but what does that actually mean in practice? Are officials worried about everyone on the ship, or is it more specific than that?
It's much more specific than just being on the same ship. And that's shaping how officials are running contact tracing right now. The CDC describes Andes virus person-to-person spread as rare and tied to actual close contact with someone who's sick. The confirmed cases in this outbreak that came after the first one were, per NBC News reporting, all among people who had direct contact with other patients on the ship, not people who simply shared dining areas or walked the same deck. The ECDC's public Q&A on the outbreak echoes that framing, with close contact as the operative concern rather than casual proximity. Where it gets genuinely murky, as Scientific American reported, is exactly what close contact means at the biological level. Scientists don't yet have a clean answer on whether transmission requires physical contact, respiratory droplets at short range, or something else entirely. So officials are being cautious. Close cabin mates, caregivers, and people with sustained face-to-face exposure are the priority population, not everyone who sat in the same dining room.
So if you were a crew member who helped move a sick passenger to the medical bay, that's a very different risk profile than a passenger who sat 2 tables away at dinner.
Exactly. That caregiving or hands-on contact scenario is precisely what public health teams are focused on. The CDC is explicit. If you think you had contact with a person who has Andes-virus and you're developing symptoms, reach out to a medical professional immediately. Don't wait and see. And as investigators keep working to understand how the very first person on this ship got infected in the first place, the answer could change what close enough to matter actually means. From Lindsay Schutel, Claire Moses, and Amelia Nierenberg at the New York Times.
The MV Hondius, the vessel at the center of a Hantavirus outbreak, is no ordinary cruise ship. It does not have a round-the-clock bar or buffet service, according to passengers who have sailed on it before. There are no swimming pools or hot tubs on deck. Sometimes there are sniffer dogs to make sure passengers don't bring contaminants on board when they go on shore to sensitive ecosystems.
So the NYT talked to former passengers, and the line they keep landing on is that the crew took safety very seriously. No buffet, no hot tubs, sniffer dogs at the gangway, more expedition ship than party boat.
And that demographic matters more than it sounds. Small expedition vessel, older international travelers, 23 nationalities? That's exactly the population the 42-day monitoring window has to chase across borders.
Right, but here's where I want to be careful. All week, I've been leaning on operators that minimize without specifics. This is different. These are passengers vouching for the crew, not the company putting out a statement. Doesn't make the virus care how conscientious the crew was, but it's not the same thing as a press release.
Fair distinction. The piece adds texture, not a number. And after this morning's commission notice, the number not moving is the headline today.
Have a question, a story idea, or a correction for Hantavirus Watch? Send us a note anytime at hantaviruswatch@lanternpodcasts.com. We really do read your messages. You'll find links to all the stories we covered today in the show notes. If one caught your attention, that's the place to dig in a little further. That's Hantavirus Watch for today. This is a Lantern podcast.